Good morning, everyone. This is Sarah Willey. I am here today with my colleague, Cindy Andre, and we are presenting probably one of our favorite webinars so far, a look back at COVID-19, 1 year in review. And what Sandy and I are going to do today is look at our very first COVID-19 webinar that we presented it was actually on March 13th. I'll never forget because it was Friday the 13th, 2020 on COVID-19. We've taken that same presentation and those top 10 questions that we covered, and we've adapted them for what's happening today to answer all of your questions regarding COVID-19 today. And when Sandy and I pulled up that presentation and started looking back through those questions, boy, it was remarkable how similar those questions still are today. They just needed a bit of tweaking for everyone. So I think you're really going to enjoy the presentation today. I think you're going to get a lot of great information out of it, and Sandy is going to take the lead.
Thanks, Sarah. Good morning, everybody. As Sarah mentioned, this first presentation was on March 13th, and we've dusted it off and updated the information for what is relevant in the place that we are at in the pandemic today. So first question, the old question, is this a pandemic? And the new question, is this still a pandemic? When will the pandemic be over? Tell us, Miller Johnson attorneys, please. Next slide. So let's just take a walk back and remember. So it was on Wednesday, March 11th, that the World Health Organization declared COVID-19 a pandemic, which they define as a worldwide spread of new disease for which people do not have immunity, right? And so as of February of 2021, the World Health Organization was still describing us as being in the acute phase of the pandemic. And we know it was right around that time that several other dominoes essentially started to fall, right? Here in Michigan, we had Michigan declared a state of emergency or their own disaster declarations also on March 11th. And the federal government, President Trump, followed soon thereafter on that Friday, the 13th, kind of taking WHO's lead on that piece. Next slide, please. So where are we? When will this be over? All of those pieces. So you probably don't remember, maybe you do, right? When we first started talking about COVID and had our very first webinar, we borrowed a lot on the employment side with what the CDC and the EEOC and various federal agencies said about H1N1, right? What can employers do when we were in the H1N1 pandemic in 2009? So here we are a year later, kind of borrowing and taking a look at some of those H1N1 pieces to help us understand where we might be headed and what that time frame is. So essentially, the WHO has a number of phases when they consider, right, beginning pandemic, post-pandemic phase. And so in this phase 5-6 pandemic is when there's widespread human infection. Now, back in 2009, WHO declared post-pandemic for H1N1 only a few months in, right? So the pandemic declaration happened in early spring, and by summer, they declared post-pandemic status for the H1N1. Obviously, we're not moving quite that quickly, but what we know is that it is a phased approach, and what WHO tells us is what phase we are in is essentially providing guidance to the countries of the world on the implementation activities that they should be engaging in, right? So it's more of not necessarily an epidemiological a future projection, but rather taking a look at the data in determining where we are in the pandemic phase and that what mitigation strategies should go along with that. And so we obviously know that we're in vaccination mode right now. So hopefully we're starting on the downslide of the peak there. Okay, next slide, please. Okay, original question. How do I keep it out of my workplace? New question. What rules are in place to help me keep it out of my workplace, right? So in the beginning, next slide, please. In the beginning, again, we were kind of borrowing, right? What do we know from the CDC? What do we know from the WHO? What do we think we maybe should be doing? And in some ways, we've learned a lot, right? In the mitigation strategies that we take are directly informed by what we know about transmission of the disease and what symptoms of the virus look like. So we know when to keep people out and when to respond appropriately. And so as we were looking back on our original presentation, some things really haven't changed. They've just really been enhanced and tweaked a little bit. So some of those transmission pieces are still very similar, right? We know that it's transmitted through close contact, exchange of respiratory droplets. That's not new. At the time, right, we didn't know if it could be spread on surfaces, and now we know a little bit more about that. The incubation period, we know 2 to 14 days, and that matches, right, the quarantine and isolation periods and such, particularly quarantine periods for close contact. That's all still the same. And we certainly know that it can spread through asymptomatic persons. And in fact, when we did our first webinar, it was the evening before we had our webinar, right, that the National Basketball Association shut down because they had their first case of a COVID positive player who was fully asymptomatic, but they had just started testing in the NBA. And so that was really big news back then, right? That, oh, it's asymptomatic people that this can spread among. And now we know that. Symptoms, of course, those are familiar for all of you who are watching with your employer hat on. You probably could memorize these and say them in your sleep because you're doing your daily entry health screenings for all of your employees. So we know any one of fever, uncontrolled cough, atypical shortness of breath, at least here in Michigan, any one of those is going to keep you out of the workplace, or any 2 of loss of taste or smell, muscle aches, sore throat, severe headache, diarrhea, vomiting, or abdominal pain. Any 2 of those that can't be explained by a known physical condition will also keep you out of the workplace. We know that. Next slide, please. So now we know, right, there are rules that go along with those. Again, at the beginning, it was CDC and WHO guidelines that we were kind of trying to be, right, scientists ourselves to go, okay, what makes sense for my workplace and what does that mean? And helpfully, right, we now have specific rules that we can feel a little bit better that if our workplace is doing the things, we know that we're at least in compliance with the rules, and government agencies have said these are the things that are going to help mitigation in the workplace. And so that provides some sense of comfort, at least in my opinion. I think that's good news, right? So we know now that we look in a couple of different places for what the rules are that apply to our workplace. And so we've gotten pretty used to taking a look at the MDHHS orders, right? Right now, generally, they're speaking on gathering and face mask orders in terms of the orders that are applicable to all of us. Certainly, there are some industries that they're issuing more specific orders, testing orders, and things like that for residential care facilities and so on and so forth. But generally, the gathering and face mask order, of course, are going to give us information about capacity limitations, depending on the kind of workplace that we have in terms of the amount of people we can let in from a customer standpoint. And then, of course, we know that MIOSHA here in Michigan issued COVID-19 emergency rule back in October that is effective for at least 6 months, and that 6-month date is April 14th. It certainly can be extended another 6 months, and so we're watching that very closely to see what the update will be. We certainly expect some COVID-19 rules to continue after April 14th. We've gotten pretty used to that, right? To know that the end dates aren't necessarily the end dates, just an opportunity to kind of revisit. But we're hopeful that maybe some of those will relax, just like we've been seeing on the MDHHS side of the house. And then here in Michigan, we have the COVID-19 Employment Rights Act, which generally tells us as employers we have isolation and quarantine requirements for individuals in our workplace who have tested positive or who are showing symptoms or who have had close contact with individuals who have tested positive. We know that those are the rules that apply to us. And then, of course, we still look to the CDC because those guidelines are folded into some of our rules, right? Specifically, the COVID-19 Employment Rights Act, their quarantine and isolation requirements are based on CDC guidelines. And something really exciting happened last week from the CDC, that they issued an interim public health recommendation for fully vaccinated people. So fully vaccinated people are those who are 2 weeks post their final shot. So if they're in the 2-dose series, it's 2 weeks after their second shot. And if they're in the one dose series, 2 weeks after the only shot they get, are considered fully vaccinated. And folks who fall into that category, right, who are close contacts of somebody who's tested positive, the CDC is saying they don't need to quarantine if it's been a short period since they've gotten their vaccine. So that's all really good news and heading in the right direction. Next slide, please. Okay, back then, should we impose travel restrictions? And now we know what travel restrictions exist. So we'll go to the next slide. So we know that from the CDC standpoint, we've got the map here, right? In the dark red is right, level 1. And right, the most risk, right, the most widespread disease spread there. And so those are level 1 countries. And you'll see that our entire country, right, domestically here, we're all in that same category. And you can see from a global perspective, we're still very much in that space. In fact, we do still have travel restrictions that prohibit entry into the United States, right? Those not all of those went away with the change in presidential administration. So China, Iran, various parts of Europe, the United Kingdom, the Republic of Ireland, Brazil, South Africa, with exceptions, of course, travelers are prohibited from entry to the United States from those locations. And particularly, we should all be aware that the CDC has recommendations for testing and international travel, right? So all air passengers coming into the United States, regardless of where they're coming from, are required to have a negative COVID-19 test result or documentation of recovery from COVID-19 before they're even allowed to board that flight to the United States. So the next thought on everybody's mind, let's go to the next slide, is what about spring break? Here we are. I mean, I feel like almost everything old is new again. When this was happening the first time, we were kind of right on the doorstep of traditional spring break, right? Public school and higher ed spring breaks. And we were all really scrambling to think, what should we do? So from an employment perspective, we'll remind you, right, that we're not going to forbid employees from engaging in personal travel, but we can require employees to give us notice about that travel, and we can educate our employees on what their personal travel might mean for them, whether there's some hurdles to getting back into the United States, or whether you at your own workplace are going to institute a mandatory quarantine if folks travel, all of those pieces. So making sure that employees know that ahead of time, what your posture on that is going to be, and so that everybody goes in, right, with the full set of information. So sharing information with your employees is really important. Thinking about how you're going to manage the risk, maybe not from the employee who's going, right? Maybe they're fine to come back and they don't see risk there. But I do think you need to be prepared for maybe coworkers to express some hesitancy, right, for all of the employees who've been traveling internationally to come fold back into the workplace. And so maybe a right balance, right, is at least, right, the 14 days after folks return. It's really important to step up compliance efforts related to masking and cleaning and distancing and all of those pieces, okay? With that, I will kick it back over to Sarah and see if we've had any questions come in.
Sure. Just a few questions, Sandy. First is a question that I know I'm getting every day, sometimes multiple times a day. and it relates to remote work. Can employers let those office employees who have been working remotely because they can do their jobs at home, can they have them come back to work now? And if not, do we have any indication as to when we might be able to do that? I know lots of people have been working from home for almost a year now, are wondering and wanting to plan their summers to figure out whether they're going to be at home or in the workplace. And I know I have thoughts about that, but what are your thoughts first with regard to that question?
Yeah, so it's important for folks to remember that the remote work requirement lives in the MIOSHA rule, not the MDHHS orders, right? So as we see, the MDHHS orders have certainly moved and been updated at a quicker clip than the MIOSHA emergency rule. That remote work requirement really hasn't changed. Now, certainly the feasibility of somebody being able to perform their work remotely, that can change based on what they're doing in the circumstances of your organization. So we talked about the MIOSHA rule right now is the 6-month date is April 14th. And so we're watching that really closely. We've gotten information that the governor has assembled a work group of business leaders from across Michigan to specifically look at the impact of office work. And so we were thrilled to see that information come across because, as Sarah mentioned, that's the most popular question, I think, right? Remote office work and any question, fill in the blank about vaccines are the most popular questions right now. And people are really looking forward to getting back to work. So we see some movement there that we know that folks are paying attention to it. When, we still don't know when, but I would suspect that somewhere maybe around that April 14th date seems like a natural transition to taking a look at that requirement and maybe dialing it down or keeping it the same. Who knows? But we at least know that folks are looking at it and there's attention focused on it.
Yeah, and I also know a number of local chambers have started lobbying and putting some pressure in Lansing because downtowns, man, are really impacted by people not coming downtown. But I will say too that I was on a call last week with a number of local health departments, and they mentioned that they had seen kind of a new cluster of outbreaks in offices. And so, as you can imagine, the decision makers are kind of balancing both of those things. Just one other piece, one other question I wanted to address is when we think about the first question we covered, which was, is this still a global pandemic? Is the WHO still calling this a global pandemic? And we know the answer to that now, thanks to Sandy, which is yes, and we're somewhere in the middle of the spectrum, and so it's going to probably be a bit before it's officially over. How does that impact things like relaxed restrictions about getting health information from employees, right? And how the EEOC views that. Over the past year, the way we think about and contemplate how we operate, particularly with regard to medical exams and requiring health information, has completely shifted, right? Remember at the beginning when we were horrified at the idea of taking employees' temperatures before they came to work, right? And so what does that mean? If we get officially post-pandemic, is that when we really should be anticipating having to rethink and readjust the way we engage with employees and how and when we ask for medical information like that? Boy, that was a long question, Sandy, but I'd love your thoughts on that too, if you have any.
Yeah, Sarah, I think that's right? So we saw at the beginning, and Sarah and I remember this, right? I have a vivid memory of putting our very first presentation together. And in the middle of us putting it together to give it to all of you is when the WHO declaration happened. And it seemed like everything kind of flipped. You're right. We were saying, no, no, no. And then, oh, yep. Yes, I guess you can do that. So what I think the pandemic declaration does from the WHO is that it's a sign to the rest, right? To government agencies and state agencies about what appropriate mitigation strategies look like at different phases. And certainly we saw the EEOC, they didn't necessarily hang their hat on the pandemic declaration, but they certainly included that, right? When we're at this stage of the pandemic, these things are okay. They didn't come right out and say, when we're not at that stage of the pandemic, these things aren't okay. But I do think that that is an appropriate breadcrumb for us all to be watching. Again, it didn't necessarily turn right on that declaration, but it is the thing that every government agency seems to base their next step on.
Right. Excellent. So that's it for questions for now. Thank you, Sandy.
Okie dokie. Okay, let's go ahead and move to the next slide. Initially, when can I require employees to stay home? And now, when must I require employees to stay home, right? We want people back. In the very beginning, it was very novel if somebody was going to be having symptoms or even have a positive test, and not that that isn't something that we shouldn't react seriously to now. I remember at the very first webinar, Sarah saying, it's not probably a matter of if, it's a matter of when somebody in your workforce is going to have a confirmed positive. And so let's start to think about these things. So again, in the very beginning, we were kind of trying to piece those things together, and we went kind of back to our old trusty rules of you're always okay to keep employees out of the workplace who are visibly ill, right? You're always okay to do that. And that's still, of course, what makes sense. But here in Michigan, at least, we have very specific isolation and quarantine requirements. And for employers who are not in Michigan, we've got CDC guidelines that have informed us on what, right? We talked about principal symptoms of COVID, and we know what those pieces are, and we know what the CDC recommendations are for quarantine and isolation. So it's no longer necessarily a guessing game related to those pieces. And obviously we have, the increase in testing availability. That's something that didn't exist a year ago. And now we're into the vaccination phase. So all of those pieces coming together, we know a little bit more about what that all looks like. So here in Michigan, of course, we have the COVID-19 Employment Rights Act. And if you hear that and you start to panic and think, I've never heard of that before, it's actually just the name they finally put to Public Act 238. And I'm sure you've heard us talk about Public Act 238 a lot. And so same thing, we're talking about the same thing. And so we know here in Michigan, if you have an employee who has tested positive, they cannot return to work until they are 24 hours fever-free with no fever-reducing medications. They have completed their isolation period, and right now that is borrowing from the CDC, excuse me, the CDC guidelines. CDC guidelines, which says that period is 10 days and that their other principal symptoms of COVID have improved. If I am somebody who's exhibiting principal symptoms, right? So remember, it's any one of these three symptoms or two or more of these other group of symptoms. That's I'm somebody who's displaying the principal symptoms. And so to get me back to work, I either need to go get a test, and that test needs to be negative, or I need to go ahead and serve an isolation period, which is that CDC 10 days. My symptoms need to have improved, and I need to be 24 hours fever-free. So there's two areas there if I'm just showing symptoms but have not yet tested positive. And then, of course, if I am in close contact with somebody who has tested positive, I am subject to a quarantine period, which right now the CDC and MDHHS together generally say is 10 days. Or I've had a healthcare provider or public health professional tell me that I've completed my quarantine period For example, if they've recommended a longer quarantine period, or in some cases, maybe a shorter quarantine period. Now, certainly we know that there are certain types of employers and certain types of employees who are exempt from that close contact quarantine period. And now we also know that fully vaccinated individuals fall into that category too. So that's become a little bit more in focus in the last year, knowing the answer to that question. Next slide, please. And so over the course of the next 2 slides, you'll see a very similar framework. We'll start here. Must I pay employees who cannot work? And now the question is, must I still pay employees who cannot work? Next slide. And so you'll see that we've kind of dusted off the old framework that still applies today. So the first question is always going to be why? Why is my employee missing work? And then, do any federal or state laws require me to pay the employee for not being at work? Then, do any of our organization's policies require us to pay the employee for not being at work? And then at the end of the day, what, if any, employee relations concerns should we be considering regarding pay or no pay? Next slide, please. So we have gone on quite the journey on the paid leave standpoint, right? On our very first webinar, the FFCRA didn't exist. And now it exists kind of ish. Right now it's a tax benefit rather than mandated paid leave. And so we've kind of almost come full circle in some ways. So we know that if your employee is missing work for reasons related to their own illness, related to COVID-19 symptoms, their own quarantine, caring for others who are experiencing symptoms or under quarantine for COVID, or caring for well children related to school or place of care closures, we know, right, that the FFCRA reasons for leave might kick in. If you're an employer who is voluntarily extending paid leave under the FFCRA to take the tax benefit, you know that those are things that are going to qualify for paid leave. Here in Michigan, and in many, many other states, there are paid sick leave laws. Here in Michigan, it's the Michigan Paid Medical Leave Act, which we know is very broad reasons, right? It doesn't have to be COVID related. It's my own injury, illness, diagnosis, preventative care, or caring for somebody else for any of those reasons are qualifying reasons for Michigan Paid Medical Leave. So maybe the first time we were talking to you, you were somewhere through your Michigan paid medical leave benefit year. But fast forward a year later, remember that employees, certain employers are covered and employees are covered and can earn generally about 40 hours a benefit year in Michigan paid medical leave. So even though maybe you're not continuing the FFCRA benefits, you've still got Michigan paid medical leave and other things to think about. Workers' compensation, we've included that here because certainly if there's any inclination that the employee has contracted their injury or illness or something in the work environment, right, in the course of performing their duties in the scope of their employment, that's going to be something that would be covered by workers' compensation. And then, of course, you're going to look at your own organizational policies. What does your vacation policy say? What does your personal time off policy or your PTO policy say in terms of when employees can take leave? And then from the employee relations standpoint, this piece hasn't changed, right? You want to balance encouraging employees to stay home when they are ill. And right back then we were saying, hey, consider work from home. What a novel idea. I bet a lot of people could work from home if we thought more broadly about that. And my goodness, our eyes have been opened over the last year about all of the types of work that can be done from home. And so if you know, you've got an employee who's well enough to work, but is just experiencing symptoms and not well enough to be in the workplace, that remains a viable option too. And then you don't even have to think of a paid leave component. Okay, next slide, please. And similar, should I discipline employees who cannot work? Can I discipline employees who cannot work? Next slide, and you'll see it's a very similar framework that we're always going to start with. Okay, what is the reason the employee is missing work? And do any federal or state laws protect that reason from discipline or discharge? right, that require the employer to protect the missed time from attendance policies and things such as that. And then, of course, do any of our organization's policies require us to protect the missed time, even if federal or state law do not do that? And again, what employer relations concerns should we be considering? And so as we go to the next slide, we can see the list here, right? If we've got employees who are missing work due to illness, a number of things could come into play, right? The FMLA could come into play, depending on, right, if it's a serious health condition, if it meets that threshold. The ADA could come into play if there's some kind of underlying, if an individual has an underlying health condition and they're missing work, that certainly could come into play. Again, for those who are continuing the FFCRA benefits, tax benefits, all of the covered reasons there, and those have just been expanded, right, by the American Recovery Plan. Here in Michigan, again, we've got the COVID-19 Employment Rights Act. So if I've tested positive or I'm experiencing symptoms, those are going to be things that protect me from discipline. It doesn't necessarily mean that the employer is obligated to pay me for the time that I am gone, but I'm required to stay out of the workplace. And so certainly my absences are going to be protected from discipline. And then, of course, we talked about Michigan paid medical leave and other state paid sick laws. If I'm missing work due to quarantine, right, so maybe I'm not sick, but I've been a close contact or a healthcare provider has advised me that I need to stay home, again, another a handful of protections could come into place. Similarly, ADA, right? If I've got an underlying medical condition where I'm at risk of severe illness, if I contract COVID, maybe my healthcare provider has advised me, hey, Sandy, you need to be working from home for the duration or until the vaccine is available to you, or. And the employer may have an obligation to engage in the reasonable accommodation process, right? The interactive process with me to evaluate that related to what my essential job functions are. And so we talked about FFCRA, right? Quarantine is a covered reason if you're engaging in the extension of the tax benefits there. Obviously, a quarantine requirement under the COVID-19 Employment Rights Act, and Michigan paid medical leave. And then, of course, just public policy concerns, right? If somebody is experiencing, right, way back then, we didn't have the COVID-19 Employment Rights Act. And so certainly at that time, right, we were starting stay home orders and we were learning a little bit more about COVID. And so from a public policy standpoint, the concern was if we're making people or dinging people for missing work because they're experiencing these symptoms, that isn't in keeping with the public policy of the state, and there could potentially be a claim there. So here in Michigan, again, we have the COVID-19 Employment Rights Act, and so some of those questions have been answered. Next slide, please. Again, if we're missing work to care for others who are ill, FMLA, FFCRA, MPMLA could come into play there. And if we're missing work to care for children who are well, school or place of care closure, FFCRA and Michigan paid medical leaves and other state laws could be impacted there. In a year later, we still have to put, right, we're still putting this kind of tagline at the bottom, continue to watch for developments in federal law and regulation. At that time, we knew the FFCRA was coming down the pike, so we knew something was brewing. But now, of course, we've had an administration change, and we know that there's a number of initiatives. Some were included, right, in the American Rescue Plan, of course, but there are other things kind of starting and moving their way through Congress related to these pieces, not necessarily specifically about COVID or COVID symptoms, but just generally paid leave in general. So that's one piece that we'll continue to keep our eye on. Actually, maybe this is a good time for us to take a pause and see if there have been any questions.
Yeah, thanks, Sandy. Just a couple of questions. I think seeking clarification on that FFCRA piece that you talked about already. And so I'll just reiterate, first, understand that after December 31st, no employer is required to provide paid time under the FFCRA, okay? And so that's an appropriate starting place. We now have had two different iterations of changes to the FFCRA that was effective last April 1st, okay? So all of the mandated requirements sunsetted, expired at the end of 2020. However, starting January 1st, employers were allowed to continue to apply emergency paid sick leave and the emergency FMLA leave as they exactly were through the end of March. Okay, and with the exact same amounts. And so that's where we sit still right now today, right? Exact same qualifying reasons, exact same amount, total of 80 hours. And if you provide it in compliance with the FFCRA as if it had been mandatory, then you can take the tax exemption through the end of this month. With the new American Recovery Plan, that's the new stimulus package that President Biden just signed. Now, those voluntary options have been extended from April 1st through the end of September. And this time, they made it a little bit more interesting. They added a couple of reasons that employees, for which you could provide paid leave to employees voluntarily and take the tax exemption. Those two new qualifying reasons are to get the vaccine, and also if an employee can't work because they're experiencing symptoms or having side effects or have a medical condition related to the vaccine, okay? So those two are new. That becomes effective, though, April 1st, okay? That's a frustration, I'll just say right now, for many employers, because many employers have been have had their employees already eligible to receive the vaccine and have been giving them paid time off in order to do that. And so it is a little frustrating that you can't take the tax exemption for having done that until April 1st. We are looking deeper into that question to try to determine whether there's any sort of argument you can make that you could take the tax exemption for paid time that you provided for vaccine-related reasons prior to April 1st if you take the tax exemption after April 1st. So stay tuned on that. I don't have a firm answer quite yet on that. On its face, I don't think you can, but I want to make sure that there's no argument to be made. And then the second thing that the new American Recovery Plan adds with regard to emergency paid sick leave is it gives employees another bank of 80 hours effectively starting April 1st, okay? So that's where we sit. Yes, it can still be used for the closure of school and daycare. I'll be honest, I'm not seeing a lot of that anymore except for temporary closures because most schools have some sort of in-person option now. Granted, some of it is hybrid. And daycare is generally open, okay? Yes, if you can choose to provide this paid time for certain qualifying reasons, but not others, and take the tax exemption for those. Okay, so those are all the questions I think I covered with regard to the FFCRA. And then one new question just came in. To cover COVID-related absences under the FMLA, do we need to require a medical certification to be completed? Okay, and this really is an FMLA question, quite honestly. So this is a good example of we can step back and think about the laws in normal times also and apply them in COVID times. So the FMLA never requires employers to obtain an FMLA cert in order to certify time off under the FMLA. However, you really do have to have enough information to know for sure that it falls under the FMLA in order to designate it, okay? So in this example, if an employee is missing work due to COVID, and you have other medical information in hand that confirms for you, yes, this person is incapacitated from working because of a serious health condition. For example, they can't work for more than 3 full calendar days, and they went and saw a healthcare provider twice, or they went and saw a healthcare provider once and got a prescription, then you could just go ahead and certify that and not require the certification itself. I would caution you on one thing though. Don't assume that every time somebody tests positive for COVID that necessarily qualifies as a serious health condition under the FMLA. The definition of serious health condition under the FMLA has not changed, right? And so to fall under one of those definitions, you would have to have that incapacity, the usual requirements for incapacity and treatment. One more question, are the 2 new vaccine paid time off in full or 2/3 pay? I believe those are full pay, is that right, Sandy?
I think that's right, but we'll double check that and put it in the Q&A.
Perfect. All right, that's it for now.
Okie doke. Okay, back to question 4. Back then it was, can I require a medical certification to allow employees back to work? And now, wow, our access or the potential for health information that could be coming across our desk has increased exponentially. So can I require test results? Can I require vaccination records? Can I still require medical certifications to allow employees to return to work? So let's walk our way through that a little bit. Okay, so let's talk about alluding to something that Sarah said at the beginning of the presentation today, right? Remember that the EEOC has taken a really broad position related to medical inquiries during the pandemic, specifically as it's related to COVID. And we, amongst ourselves here at Miller Johnson, think, wow, this is going to be really hard for us to kind of put the toothpaste back in the tube, right? Once we're in the after times here, the alarm that we felt when we thought, oh my gosh, we're going to take someone's temperature and record what their temperature was and keep it in an employee record, that seems so out of bounds. And now we're kind of in this space where we get to ask for lots of stuff, and it's okay as long as, right, confidential medical record, all of those pieces, that it might be a harder transition once we come out of these times, but we'll kick the can down the road on that, and we'll help you all through that when the time comes. We're anxious for it to be the after times too, so the sooner the better. We'll help you deal with that. But on the medical certification side, remember, the EEOC has said generally like return to work slips, right? So a healthcare provider says so-and-so can return to work. That is not a disability related inquiry. So nothing in the ADA would prohibit the employer from requesting that and keeping that in their records, or to the extent that you are requiring a certification, right, to show that somebody is fit for duty, so to speak, as long as that's job related and consistent with business necessity, you're fine. And right, and from a safety standpoint, that's exactly why you're requiring it, right? You've got your legitimate business reason there as long as you're applying it appropriately, right? Test results. In some situations, right, you're certainly entitled to know those test results because you've got to know if people can be in or out. And so we know from our daily entry screenings, right, MyOSHA requires all of us to include a questionnaire that minimally includes symptoms and exposure and all of those pieces. And so we know that we're allowed to ask employees who are going to be physically entering our workplace if they have COVID or symptoms associated with COVID, if they've been tested for COVID. And the EEOC even lets employers administer COVID tests themselves. And in fact, MDHS in some situations requires certain employers to have their staff undergo regular COVID testing. So that's certainly fine. And what we're learning about vaccination records, the EEOC says, yes, at this point, it's absolutely fine to ask employees to show you proof of receipt of a COVID vaccine. They say that's not a disability-related inquiry. And one of the reasons that it's particularly helpful, right, as of last week, when we find out from the CDC what they're saying about the things that fully vaccinated individuals can do. And one of those pieces is that they don't have to be subject to quarantine, right? So it's even more important for employers, quite frankly, to request and retain those records, because as you have a positive case in your workplace, a customer or an employee, and you're engaging in contact tracing and you're trying to figure out who do I need to send home, who is it okay to keep working, it's going to be a really important data point for you to know, okay, so-and-so is a fully vaccinated individual, they're not subject to quarantine, and I can kind of keep going through my analysis. But having proof of that is really critical. Not that we wouldn't trust our employees to tell us the truth, but having proof of that full vaccination status and the timeframes that are really critical is really important for you from an employment standpoint. Okay, next slide, please. Okay, can I require employees to work if they fear being at work? We didn't change this one too much, so we'll kind of dive right into the analysis. So we do still get that question from time to time. I will say in the beginning, it seemed more regular, right? When there was so much unknown and we didn't know what work was going to look like. Now we're a year in. If we've still got employees who are fearful for returning to work, that may implicate, right, an ADA concern, right? I'm fearful to return to work because I've got this underlying medical condition that puts me at more severe risk if I get COVID. That pushes us into the ADA, interactive reasonable accommodation process, and that's something different, right? Maybe we could all kind of go through that analysis in our sleep. But again, so the first question is always going to be, why is the employee afraid, right? If it's because I've got an underlying medical condition, we know that that shoots us into ADA world. If it's just my general fear of COVID, or I don't think my workplace is safe, the employer has the ability to do some homework here and take a look. So you may remember at the end of calendar 2020, the Michigan legislature passed a package, and the governor signed kind of a package of bills that I'll kind of just generally talk about as being business liability protections, right? One was the COVID Response and Reopening Liability Assurance Act, and that was related. So it was House Bill 6030 for those, right? Those playing at home and who know those things. But that is a general business liability protection from tort liability, right? So if you a customer or a client who says, I was in your, I was a visitor to your business and I think that I caught COVID, the business itself has a liability protection if they have been compliant with all of the COVID rules, regulations, guidelines that have been enforced or in effect at the time, right? So from an employment standpoint, we've got the MIOSHA rule, we've got the MDHHS orders, we've got the COVID-19 Employment Rights Act, we've got all of those pieces. And from an employment perspective, if you can say, we're doing all the things, right? We're doing all the things that the MIOSHA rule says, we're doing all the things that the MDHHS order says in terms of capacity and spacing for customers, and we're on the COVID-19 Employment Rights Act, we're keeping people out when they're subject to isolation or quarantine. If you're able to kind of check all of those boxes, you've got some business liability protection. But that also informs your analysis when you have an employee saying, I'm too scared to return to the workplace, right? You can say, we're doing all of the things that we're required to do. And so it's perfectly permissible for us to say, you're required to be here. Also included in that package was an amendment to the MIOSHA Act, right? So MIOSHA says, right, if an employee, and I'm paraphrasing here, but if they're in reasonable fear of unsafe working conditions, they can refuse to work. And so here, right, that amendment to the MIOSHA Act is kind of the same thought related to the tort liability protection, right? Hey, employer, if you're doing all of the things, you're protected from a claim under this section of the MIOSHA Act, right? The employee that can refuse work due to unsafe working conditions. So those all make sense. And then of course, we know the COVID-19 Employment Rights Act adds into that too, right? So that again, when we think about what rules, the MDHHS orders, the MIOSHA rule, the COVID-19 Employment Rights Act, and any other pieces if you're in an industry, right, that requires testing or has additional restrictions through MDHHS, that we're following all those pieces too. So when you're able to check all of those boxes, you can say to the employee, hey, employee, you still may be scared to return to the workplace, but we know that we're doing all of the things that we can, and so we can require you to come to work. And so employee make the choice that you're going to make, essentially. Okay. Next slide, please. When must I shut down or limit operations? And it started, what if I needed to shut down some or all of operations? And gosh, as Sarah and I were putting this together, on Friday, March 13th, we could not have guessed, maybe we could have guessed, but we didn't guess. I remember not guessing, right, that 11 days later, that a shutdown or a limitation to operations would literally, at least here in Michigan, would literally impact every single person listening to the call, right? It was March 13th, and I have a school-age kiddo. So I remember that it was March 12th, right, that the governor issued the order that public school would be closing that next Monday. And so already that was, right, all of the parents of school-age kiddos or caregivers of school-age kiddos were going, okay, so school will be closed for 2 weeks, and so we'll figure that out. I mean, we couldn't have known. But now this really has touched every single person on this call in some way. Next slide, please. But hopefully, right, with the turn of summer and things generally started to reopen, and we can see that the path the MDHHS orders are taking, that we hope that we're taking steps forward and not steps backwards. So really, in terms of when you're required to limit or shut down operations, those are going to come from a couple of places, right? We know that the MDHHS order speaks to gathering and capacity restrictions. So to the extent that you are a business that is subject to a capacity restrictions, you do still have to limit your operations according to the MDHHS order. And at least in some industries, I'm thinking of food service, dine-in food service as an example, there are requirements for enhanced cleaning after you've had a COVID positive case in your environment. You're not required to shut down necessarily, but you are required to engage in enhanced cleaning, and you can't resume operations in that area until you've done that. So to the extent that can happen while operations keep up and running, that's fine. But understanding that where you're looking to now to determine, am I even allowed to be open? We're thankfully are in a much different and better place than we were 6, 7, 8 months ago on that question. And we know generally we'll look to the MDHHS order. And I'll give my shameless plug, like I do almost every time you guys hear from me. Let's also not forget about local health department orders. Now, right at the beginning, it was really a matrix that we needed to kind of look in a lot of different places. And we almost knew that our local must be saying something different about this too. So let's be sure to look. Still want to be sure to look. We see a lot less of those restrictions related to local health department orders, but they're not gone completely, particularly in places that have spikes or related to large type of quarantinable, I guess is what I'll call events, right? So we see kind of stay in place orders around college and university areas, right? Those are things that we're still seeing. And so depending on where you're located and the kind of business that you're operating, it's still important to keep that in the back of your mind as you're evaluating, can I be open? How can I be open? How much can I be open? All of those pieces. Okay, and our last question. What should I communicate to employees right now? So this was the same question we had way back then, and some of our advice hasn't changed. It's just gotten refined a little bit based on what we think your employees are probably asking you. So you might remember that our goal at the time, right, was to kind of, we were just starting out. We had no idea how crazy it was going to be, but at the time we were saying, hey, the most important thing here is to demonstrate your knowledge in this area and instill calm and confidence, right? So like I said, I'm a parent to a school-age kiddo, and so I always think, okay, I've got to bring calm to her chaos. Like that's my job, right? Even if I want to add to the chaos, I sometimes do that. I do that a fair amount too. But now, and we didn't know how to do that back then, really, right? There were no rules that we could really grab onto. I mean, I think there's some security in saying, I know the thing to do and I'm doing all the things. And so now we have some of those rules that we know some of the things that we're supposed to do, and we can have a sense of security and comfort when we're doing all those things. So we know by this point, again, you probably know all the MIOSHA emergency rule requirements in your sleep, but we know we need a preparedness and response plan. We know we've got to be training our employees and keeping them up to date when anything changes that we would need to retrain on. We know that we've got remote work requirements, and hopefully we'll be looking forward to a relaxation of those soon. But another thing that we should be continuing to talk to our employees about is providing them vaccination information, right? And so to the extent that you're partnering with your local health department in terms of this is the kind of employee I am, right? Maybe I've got essential workers or I'm a child care facility. So I can be passing information along to my employees about when the vaccine might be available to them by way of their employment with me. Certainly, folks will have the vaccine available to them based on their own age and medical condition that has nothing to do with their employment. Passing that information along to them too, so that you can provide them correct and factual information. The CDC has a lot of really great business and workplace resources, and we've got the link to that in our resource centers too. But then also remembering mitigation strategies. So it's really exciting that we're transitioning into this vaccination phase of the pandemic. But all of the mitigation strategies requirements still apply to us, right? So the MIOSHA rule still exists, and it says nothing in the MIOSHA rule about anything different for fully vaccinated individuals, right? So in terms of face mask requirements and social distancing and masks and shared spaces and daily entry screening, all of those pieces, none of those stop, at least as it exists today on March 16th, right, 2020. All of those things, same things exist today, even if your entire workforce could be classified as fully vaccinated. So it's really important that we remind people of that too, right? So even though in some ways, right, the CDC has said, hey, fully vaccinated people, you can have residential gatherings with unvaccinated people or in these groups and these pieces, and that's good and wonderful and excellent and a step in the right direction. But what we do in the workplace doesn't necessarily recognize those things just yet, because we're still subject to the MIOSHA rule. So it's important to make sure that we're reminding our employees about those pieces too. Okay. Any final questions?
Yeah, just a few questions. First, I just want to clarify, as promised, as Sandy was talking, of course, I just reached right over and grabbed the original FFCRA and the American Rescue Plan from my desk here, because, you know, we keep all of these things at arm's reach at all times. And yes, confirming that emergency paid sick leave for vaccine-related reasons is paid at 100%. Next question is one that I'm getting a lot. Help us understand that for employees who have now been fully vaccinated, and as Sandy said, that is 2 weeks after whatever the final shot is. If it's the Johnson & Johnson shot, it's just one. If it's Pfizer or Moderna, it's the second shot. Do employees still have to quarantine or isolate? What does the CDC say about that, and what does that mean for us? As of right now, the CDC is making a distinction between quarantine and isolation requirements for people who have been fully vaccinated. So remember, quarantine refers to when an employee needs to stay home because they've been in close contact with somebody who's been confirmed to have COVID. So that means that person doesn't have symptoms and the person quarantining doesn't themselves have symptoms and hasn't themselves tested positive, okay? In that limited circumstance, the CDC says if you've been fully vaccinated and you're within 90 days of that time period of having been fully vaccinated, you don't have to quarantine, even if you find out that the person that you went out to dinner with last night just tested positive for COVID. Okay, and because the COVID Employment Rights Act folds in the CDC guidance now in its definition of quarantine period, employers in Michigan can also apply that current guidance. However, with regard to isolation, that is not true. Okay, so remember, the isolation period refers to the time period in which someone's supposed to stay home because they have symptoms of COVID or because they've tested positive. You still have to follow those isolation requirements according to the CDC, and then of course under the COVID Employment Rights Act, even if you've been vaccinated, right? These vaccines have a fantastic, wonderful are surpassing expectation success rate, right? It's between 94 and 97%, which is wonderful, but it's not 100. And so for now, if you have symptoms of COVID or you've actually tested positive, you do still have to isolate even if you've been quarantining. One last question. Are there any suggestions on how to approach employees concerning providing a copy of their vaccination card, right? Well, that's really a communication question. I personally don't think you should feel reticent to ask that question at all. And I would couch it in first conveying the need, making sure employees understand our need for that information. And we really do need it right now immediately for contact tracing purposes. We need to know who does or doesn't have to quarantine if somebody in the workplace tests positive for COVID. And that's a wonderful thing, right? Tell us now if you've been vaccinated so that we can have that information and understand it when we do contact tracing. But also in the not too distant future, we really are going to be seeing different COVID protocols in the workplace for employees who've been vaccinated and employees who have not. I feel very confident in saying that. Our mask rules are going to be different. And so we need to understand who's been vaccinated and who's not. I don't think you can quite make that specific promise yet, but I think you can allude to it in your communication, right? As we plan for what requirements and protocols are going to be in place in the future, we need to understand whether employees have received the vaccine, and therefore we are asking you all to let us know that and provide us a copy of that card. And with that, cheers to a year. Unfortunately, it's at 9 in the morning, so we can only cheers with our coffee, right? But cheers to surviving a year and the ups and downs of COVID. And thank you all for being present in our webinars over the past year. They are not ending now. They will continue. But thank you all very much. And thanks, Sandy, for all the awesome information today.
Awesome. Thanks, Sarah. Have a great day, everybody.
Bye-bye.